I'm going to go into a series on first assisting with bowel resections. So before we get into the actual surgery itself, I just want to do a very brief overview of some of the pre-op workup that might be done that might happen before they get to the surgery. So what are some of the chief complaints that they might be looking for on a history? Does the patient have pain? Does the patient have signs of an obstruction? Does the patient have a change in their stools, whether it's more constipated, more frequent, less frequent, looser, diarrhea, whatever it is? They're looking for a change in the stool. Do they have blood in the stool? And that may either be observable or it may be occult when they can't really see it. If there's a lot of blood in it, the blood's going to is going to make it that black, tarry, sticky stool. And do they have weight loss? Weight loss would probably be not a good sign because it might indicate that there might be some sort of cancer or malignancy. So as far as the physical, when they're doing a physical exam on the abdomen, it's a different order than in any other part of the body. Usually you inspect, you palpate, you auscultate, percuss. In this instance, they're going to start with the inspection to look at it to see if they can see any abnormality when they look at it. And then they're not going to palpate, because by palpating they may change the bowel sounds and it may not give them an accurate picture of what's going on. So the next thing they're going to do is they're going to auscultate. So they're going to listen to see if they hear the normal bowel sounds, if they hear borborygmus, if they can hear the peristalsis going on. Then after that, they're going to palpate it. Do they feel any masses? Do they feel any abnormalities? Is it painful when they push in any area? And then the last thing they're going to do is they're going to percuss. Does one area sound dull and another sounds air-filled and rebounding? Is there a difference in the tone? And that can tell the practitioner a lot. Now, just really briefly, some of the lab work that they may do. Some of the blood studies, they may do a CBC to see if there's any anemia. And again, if there's anemia, are they losing blood somewhere? Or is the anemia from a malignancy? Do they have any occults? They're going to take a stool sample to look for frank blood or occult blood. And then in the blood study, they're going to look also at the WBCs, because if there's a perforation and there's an infection going on as a result of a perforated diverticulum, then they're going to have an elevated white count. So they're looking for that. And then if the doctor is concerned about anything they see or have a question, they might do further studies like a CAT scan or an MRI to rule out and get a better picture of what's going on.